This week we've been investigating the dangers of sugar on our health, and one of the most alarming outcomes of consuming too much sugar is, of course, type 2 diabetes.
Yeah, it's a debilitating disease that can have absolutely devastating consequences. But experts are warning that we are not taking the warning signs seriously enough.
Right now, over 1.1 million Australians have type 2 diabetes.
Australia is in the grip of a diabetes epidemic.
There could be another 500,000 people with type 2 diabetes who haven't been diagnosed yet. That is, they're walking around with silent, undiagnosed type 2 diabetes.
But we're ignoring the warning signs.
I thought, nah, it won't happen. It's not going to happen to me. I'm young. Here we are 30 years later.
Paul Walker, a former truck driver, was diagnosed with type 2 diabetes 27 years ago.
While you're on the road, you just stop at servos and that and just get takeaways. Lived on takeaway. Didn't bother me. Invincible.
After dismissing the early symptoms, he's now paying the price.
I had a lot of problems. Like, I had a triple bypass 2 years ago. I've got hydrocephalus, I have a shunt in my head. It drains all the fluid off the brain. And now I've got stage 4 kidney failure. So I'll have to go on dialysis soon. It's my fault I got this way. Doctor told me that I was going to end up killing myself from the inside out, which it's happened.
Disturbingly, cases like Paul's are on the rise. And at the Diabetes Centre in Sydney's St Vincent's Hospital, worrying trends are emerging.
Heart attack, stroke, peripheral vascular disease, so impaired blood supply to the legs, amputations, blindness and kidney disease that are all complications of diabetes. Now we are also seeing type 2 diabetes develop in young children as young as sort of 10 to 20 because of the increasing epidemic of obesity that we are observing.
Patient Paul Kidd knows the dangers of an unhealthy lifestyle all too well. After living with type 2 diabetes for 20 years, he's now insulin dependent.
I worked very, very hard to get it. I didn't mind a drink. I ate anything that you put in front of me. I was a very naughty boy.
What would you say to people to prevent ever having to even explore?
Oh God, they're gonna hate this one. Give up the drink. The dreaded drink. That's the number one problem, I think. Can't have anything with sugar in it. Even though you try and escape sugar as best you can, you eat a bread roll, it's full of sugar.
2 million Australians are now categorised as being at high risk of developing type 2 diabetes in the next 5 years. But the message is not getting through.
People think it's somehow, they sometimes get messages that it can be mild type 2 diabetes or you don't have to worry about it too much. It's a very serious condition. There's a disconnect. It's really important for people to understand just how serious this problem is.
Greg Johnson from Diabetes Australia says our current lifestyle is largely to blame.
On average, we eat much more processed food. We eat more food with added fat, added sugar, added salt. We eat more fast food.
And with no cure, the onus is on all of us to take charge of our health before it's too late.
The problem is that often the symptoms are not shown until late. So many people can have type 2 diabetes silently and it's not diagnosed.
Number one, go and see your GP and let your GP take a blood sugar level.
I'd say don't be an idiot. Don't be like me. I was just in denial all the time.
Yeah, it is a silent epidemic, and as Greg Johnson from Diabetes Australia points out, there is this disconnect. I mean, we see, we know that, you know, eating the wrong foods and eating excessively makes us fat, but a lot of people, there are 500,000 people walking around right now undiagnosed with type 2 diabetes, and of course, once those symptoms escalate, it does lead to really big, dangerous health complications.
Many of our viewers will probably remember Shelley Horton coming on the program a number of months ago. to tell us that she had reversed her type 2 diabetes as a result of a diet that she's been on. She's dropped a lot of weight, she's feeling great, and most significantly, she has reversed her type 2 diabetes. So awareness is crucial, because if you start taking actions now, you can put yourself on the right track.
So I reckon, although they're all really great points, yesterday when we had Damon on, he was explaining that on packaging, there should be the number of teaspoons of sugar.
Yeah.
I think that's a perfectly acceptable and easily digested, pardon the pun, way of pointing out to people that how much sugar is in something.
Such a good point. I can't tell you how many times I have stood in supermarket aisles looking at food packaging and trying to discern from the labelling how much sugar content is in breakfast cereal or muesli bars, or, you know, we're trying to do the right thing with our kids, but I agree with you, Carl. I think the labelling is an absolute minefield. So if that was addressed, I'm sure that would go some way to helping this problem. But, you know, if you have any concerns about your blood sugar levels, do not ignore the warning signs. Go and see your GP. Much better to have the information, and then you can do something about it.
Yes.
Also, we're not wowsers here on the Today Show. We love climbing into a sweet, and
course.
I love a fizzy drink every now and then. And
I love chocolate. I have chocolate most days, but, you know, you've just got to be mindful of, you know, if you've got a good active lifestyle and the bulk of your diet is healthy and nutritious, nothing wrong with it.
I love craft cheddar.
Yeah.
As
And we
well.
love a glass of wine.
Yeah, several. So
Don't undo your good work, Carl.